Hey ladies, welcome to GOC Grace channel once again. We have a very interesting and important topic to share in this post. Take a few minutes to explore more about your body and take control of your health and well-being. We always advise not to take care of your health on your own. Consult with a doctor for advice. Today, we are going to talk extensively on breast cancer. Stay with us. Breast cancer is a malignant tumor that originates from the cells of the breast. It is one of the most prevalent forms of cancer globally, particularly among women, although it can also affect men. According to the World Health Organization (WHO), breast cancer surpassed lung cancer in 2020 as the most commonly diagnosed cancer worldwide. Breast cancer is not a single disease, but a group of diseases with diverse biological features, behavior, and responses to treatment. Understanding the nuances of breast cancer is crucial for early detection, effective treatment, and ultimately, improving survival outcomes. Anatomy of the breast. The human breast consists primarily of lobules, milk-producing glands, ducts, channels that carry milk to the nipple, connective tissue, made up of fibrous and fatty tissue that surrounds and holds everything together. Breast cancer most commonly starts in the ducts, ductal carcinomas or lobules, lobular carcinomas. Types of breast cancer. A non-invasive in situ breast cancer. 1. Ductal carcinoma in situ disease. The cancer cells are confined within the ducts, considered the earliest form of breast cancer, and has a high cure rate. 2. Lobular carcinoma in situ LCIS. Abnormal cells in the lobules, not considered true cancer, but a marker for increased breast cancer risk. B. Invasive infiltrating breast cancer. 1. Invasive ductal carcinoma IDC. Accounts for about 70–80% of all breast cancer cases, begins in the ducts and invades nearby breast tissue. 2. Invasive lobular carcinoma ILC. Starts in the lobules and can spread to surrounding tissues. See other less common types. Triple-negative breast cancer 10BC. Lacks estrogen, progesterone, and HER2 receptors, aggressive and difficult to treat. HER2-positive breast cancer overexpresses a HER2 protein, often more aggressive but treatable with targeted therapy. Inflammatory breast cancer, rare and aggressive, characterized by swollen, red, and warm breast tissue, Paget's disease of the nipple. Starts in the ducts and spreads to the nipple. Male breast cancer. Though rare, men can develop breast cancer. Risk factors, typically IDC, genetic and hereditary factors, mutations in genes such as BRCA1 and BRCA2, family history of breast or ovarian cancer, inherited conditions like Li-Fraumeni syndrome. B. Hormonal and reproductive history. Early menstruation before age 12, late menopause after age 55, having first child after age 30 or never having children. Use of hormone replacement therapy (HERT), oral contraceptive use. See lifestyle factors, alcohol consumption, smoking, sedentary lifestyle, obesity, especially after menopause, high-fat diet and poor nutrition. D. Environmental factors, radiation exposure, certain workplace chemicals, for example benzene, ethylene oxide. Symptoms of breast cancer. While many breast cancers are detected via screening before symptoms arise, common symptoms include a lump or mass in the breast or underarm, swelling or changes in breast size or shape, skin dimpling or puckering like an orange peel, nipple retraction or inversion, nipple discharge particularly bloody or clear, redness or scaling of the breast or nipple skin, pain though not always associated with cancer. Diagnosis, a clinical examination, physical breast exam by a healthcare professional. B. Imaging tests. Mammography, the gold standard screening tool. Ultrasound helps differentiate between cysts and solid masses. Magnetic resonance imaging (MRI) useful in high-risk patients or dense breast tissue. C. Biopsy, core needle biopsy, fine needle aspiration, or surgical biopsy to extract tissue for analysis, determines cancer type, grade, hormone receptor status, and HER2 status. Staging of breast cancer. Staging helps determine the extent of the disease and guide treatment. Stage description. Stage 0 non-invasive DCIS, Stage 1 small tumor, limited to the breast. Stage 2 larger tumor spread to nearby lymph nodes. Stage 3 extensive local spread. Stage 4 metastatic cancer, spread to other organs. The TNM system is also used, T tumor size, and node involvement, M metastasis. Treatment modalities. A. Surgery. Lumpectomy, tumor and small margin of tissue removed. Mastectomy, partial or complete removal of one or both breasts. Sentinel lymph node biopsy, checks if cancer has spread. B. Radiation therapy, typically used after surgery, to destroy remaining cancer cells. External beam radiation or brachytherapy internal. C. Chemotherapy, systemic treatment that kills fast-growing cancer cells, given before neoadjuvant or after adjuvant surgery. D. Hormonal therapy, for hormone receptor positive or PR plus cancers, includes tamoxifen or aromatase inhibitors. E. Targeted therapy, HER2 positive cancers, treated with agents like trastuzumab, Herceptin, pertuzumab, lapatinib. F. Immunotherapy, effective for certain cases, like triple-negative breast cancer, uses agents like checkpoint inhibitors to help immune system attack cancer. Prognosis and survival. Prognosis depends on stage at diagnosis, tumor biology, receptor status, patient's age, and overall health, response to treatment. 5-year survival rates. Stage OI, 100, Stage 2, 90, Stage 3, 70, Stage 4, 30. Early detection dramatically improves outcomes. Prevention and risk reduction. A. Screening, mammograms, starting at age 40-50. Depending on guidelines, clinical breast exams and self-exams, genetic testing and counseling for high-risk individuals. B. Lifestyle modifications. Regular exercise, healthy diet, limiting alcohol and tobacco, weight management. C. Medical interventions, preventive mastectomy or oophorectomy for BRCA mutation carriers, chemoprevention with tamoxifen or raloxifene in high-risk women. Psychosocial and emotional aspects. A breast cancer diagnosis can be emotionally devastating. Patients may experience anxiety and depression, body image issues especially post-surgery, sexual dysfunction, fear of recurrence. Support groups, counseling, and patient advocacy organizations play a crucial role in recovery and coping. Global impact and disparities. Breast cancer outcomes vary globally. High-income countries have better access to early detection and advanced treatment. Low- and middle-income countries often face delayed diagnosis and limited resources, leading to higher mortality. Addressing global health inequalities is vital for reducing the burden of breast cancer. Conclusion: breast cancer is a complex and multifaceted disease that requires a multidisciplinary approach for diagnosis, treatment, and support. With ongoing advances in medical science and public health, the outlook for breast cancer patients continues to improve. Early detection, education, and equitable access to care remain the cornerstones of successful breast cancer control. Always remember that it's okay to ask for help and support when you're struggling with any health condition. If you need additional information, don't hesitate to ask. Stay tuned for our next health topic.